Alright. Hey, I'm Aqua or Aquarius of Fallen Snow if you don't know me. Welcome back to this episode looking into different mental states and conditions. And this is basically our third episode in the series since I did my first one, looking at is there a link between psychopathy and nepotism or sacred bloodlines. I'll make sure I put a link to that video both in the video under the eye icon as well as in the description. Since then, we've turned it into more of a generalized conversation about different mental states and conditions because I am genuinely curious and I wanted to not only learn about them myself, but then share that information with you guys. I'll also say, if you're into philosophy, I recently dropped a history of philosophy video where I was looking at some of the most influential and well-known, as well as some lesser-known, philosophical schools throughout history that kind of got us to where we're at now, right? So if that sounds interesting to you, I'll make sure I have the link to that video in the same place as the other one. But yeah, without further ado, let's get right into it. Today, we're continuing our journey by looking at a range of fascinating and complex conditions from the impact of trauma leading to PTSD to the unique world of autism spectrum disorder. In our fast-paced and often demanding lives, gaining a deeper understanding of mental health is more vital than ever. So, let's delve into these topics guided by current research and evidence-based information to help us all better appreciate the intricacies of these conditions. Let's begin by exploring Tourette's syndrome. This is a neurological disorder that manifests through repetitive, involuntary movements and vocalizations known as tics. These tics typically emerge during childhood, usually between the ages of 2 and 15, with the average age of onset being around 6 years old. The hallmark of Tourette's syndrome is, of course, the tics. They can be quite varied, involving either physical movement, which are called motor tics, or sound, known as vocal tics. These tics can also range in complexity. For instance, simple motor tics might include things like frequently blinking the eyes, jerking the head, or shrugging the shoulders. On the other hand, complex motor tics could involve more coordinated sequences of movements, such as touching objects repetitively, mimicking movements observed in others, or, in some instances, making obscene gestures. Similarly, vocal tics can be simple, like a recurring grunt, a frequent throat clearing, or repetitive sniffing. More complex vocal tics might involve repeating specific words or phrases, or, in less common but often misunderstood symptoms, the unintentional utterance of socially inappropriate words, in a phenomenon known as coprolalia. While the precise cause of Tourette's syndrome remains a subject of ongoing research, current understanding points towards abnormalities in specific regions of the brain. These include the basal ganglia, which plays a crucial role in movement control, the frontal lobes involved in higher-level cognitive functions, and the cortex, the brain's outer layer. Furthermore, an imbalance in certain neurotransmitters, the chemical messengers in the brain, particularly dopamine, serotonin, and norepinephrine, are believed to play a significant role in the development of Tourette's syndrome. Genetics also play a substantial role. It's considered an autosomal dominant disorder, which means that if one parent carries the gene associated with TS, there is a 50% chance that their child will inherit it. Interestingly, prevalent studies have shown that males are 3 to 4 times more likely to develop Tourette's syndrome compared to females. It's also important to note that Tourette's syndrome frequently co-occurs with other neurodevelopmental or behavioral conditions, such as attention deficit/hyperactive disorder, or ADHD, and obsessive compulsive disorder, OCD. The course of Tourette's syndrome often sees tics lessen in frequency or become more manageable as individuals move through their teenage years. While there is currently no cure for Tourette's syndrome, various treatment approaches are available to help manage symptoms, particularly when they significantly interfere with daily life and well-being. Now, let's shift our focus to the impact of trauma and explore post-traumatic stress disorder, or PTSD. This condition can emerge after an individual experiences or witnesses a deeply traumatic event such as combat, natural disaster, or personal assault. PTSD is categorized by a cluster of distressing symptoms that can significantly disrupt daily functioning. These could include intrusive or unwanted thoughts or memories of the traumatic event that repeatedly surface, often accompanied by vivid nightmares and flashbacks that make the individual feel as though they are reliving the experience. Severe anxiety and a state of hypervigilance where the person is constantly on edge and overly alert are also common. Individuals with PTSD may also actively avoid anything that reminds them of the trauma, and they often experience negative shifts in their thoughts and overall mood, as well as a change in their physical and emotional reaction to stimuli. PTSD can manifest in different ways over time. Acute PTSD is diagnosed when symptoms last for less than 3 months, while chronic PTSD persists for 3 months or longer. In some cases, individuals may develop delayed onset PTSD, where symptoms don't begin to appear until at least 6 months after the traumatic event. A diagnosis of PTSD requires that the symptoms persist for more than a month and significantly impair the individual's functioning in social, occupational, or other important areas of their life. It's crucial to remember that not everyone who experiences trauma will go on to develop post-traumatic stress disorder. A range of factors, including the severity and nature of the trauma, the individual person's history and resilience, and the availability of social support systems, all play a significant role in determining who might be more susceptible. Interestingly, research has revealed a notable genetic component to PTSD. Twin studies have indicated that genetic factors can account for a substantial 30 to 40% of the variation in an individual's risk of developing PTSD. This level of hereditability is comparable to that of other complex psychiatric disorders, such as major depressive disorder. Recent advancements in genetic research have identified 95 specific genetic locations that show a strong association with PTSD risk, highlighting the intricate genetic architecture underlying this condition. Building on our understanding of trauma's impact, let's discuss acute stress disorder, or ASD. While it shares similarities with PTSD, acute stress disorder is a distinct condition that occurs within the immediate aftermath of a traumatic event, specifically within the first 2 months, and lasts for a shorter duration, between 3 days to 4 weeks. Key symptoms of ASD include dissociative experiences where an individual may feel detached from themselves or their surroundings, a sense of unreality or non-reality, the re-experiencing of the trauma through intrusive memories or distressing dreams, a marked tendency to avoid stimuli that are associated with the traumatic event, significant alterations in arousal and reactivity, and a significant distress or impairment in social, occupational, or other important areas of functioning. It's a concerning statistic that approximately 50% of individuals initially diagnosed with ASD may go on to develop full-blown PTSD if they don't receive appropriate support and intervention. This underscores the critical importance of early intervention and providing support to individuals who have recently experienced trauma. Complex PTSD, or C-PTSD, represents a more severe and often more challenging form of post-traumatic stress disorder. It typically arises not from a single traumatic event, but from prolonged and repeated exposure to trauma over time. Situations like ongoing childhood abuse, domestic violence, genocide, or being held captive are often associated with the development of C-PTSD. While individuals with C-PTSD experience all the core symptoms of PTSD, they also grapple with additional difficulties. These can include significant challenge in regulating their emotions, a deeply ingrained negative self-perception often accompanied by feelings of shame or guilt, persistent problems in forming and maintaining healthy relationships, distorted perceptions of the perpetrator of the trauma, and a profound loss of symptoms of meaning, which might manifest as a loss of faith or a pervasive sense of hopelessness. Treatment for C-PTSD often necessitates a more intensive and long-term therapeutic approach compared to traditional PTSD treatment, as it needs to address both the trauma-related symptoms and the complex emotional and interpersonal issues that have developed as a result of the prolonged adversity. Now, let's turn our attention to a different neurodevelopmental condition, autism spectrum disorder, or ASD. Now, let's turn our attention to a different neurodevelopmental condition, autism spectrum disorder, or more commonly known as autism. This condition affects how individuals perceive the world around them, how they interact socially, and how they communicate. It's described as a spectrum disorder because it manifests in a wide range of ways and to varying degrees of severity in each individual, ranging from what might be considered mild to more significant challenges. Key characteristics of autism spectrum disorder include persistent difficulties with social communication and social interactions across various contexts, as well as restricted or repetitive patterns of behavior, interests, or activities. It's important to note that these symptoms are typically present in early childhood, although they may not become fully apparent or recognized until social demands exceed the individual's capabilities. Furthermore, these symptoms must cause significant impairment in social, occupational, or other important areas of functioning to meet the criteria for an ASD diagnosis. Asperger's syndrome, which was once considered a separate diagnostic category, is now recognized as part of the broader autism spectrum disorder. Individuals who previously would have received an Asperger's diagnosis typically have average or above average intelligence and do not experience significant delays in language development. However, they often face challenges in social interactions and may have intense, highly focused interests. Individuals with ASD frequently encounter difficulties in understanding subtle social cues, nonverbal communications such as body language and facial expressions, and often unspoken rules that govern social interactions. They may struggle with making eye contact, understanding sarcasm or figurative language, engaging in reciprocal back and forth conversations, and adapting to changes in their routines. Sensory sensitivities are also common, with individuals experiencing either over or under sensitivity to various sensory inputs like light, sound, textures, and smells. It is absolutely crucial, however, to recognize that individuals with ASD also possess a unique set of strengths and abilities. These can include exceptional focus and meticulous attention to detail, a strong memory for facts and figures, innovative and often unconventional thinking and problem-solving skills, remarkable honesty and directness in their communication, and deep, often encyclopedic knowledge in their specific areas of interest. And just from reading that, I can surely say that I think I am on the spectrum, and my grandma, who was previously diagnosed with Asperger's syndrome, would also be on the spectrum as well. From a genetic standpoint, ASD is considered to be highly hereditable, with estimates of hereditability ranging from 64 to as high as 91%. Research has implicated over 800 different genes in the development of autism spectrum disorder, emphasizing its complex genetic architecture. These genetic complexities likely contribute to the wide variability in how ASD manifests from one person to another. In addition to genetics, environmental factors are also understood to play a significant role in autism development. Studies have indicated that exposure to certain environmental factors during pregnancy can increase the risk of a child's development of ASD. These factors include exposure to air pollution, particularly fine particulate matter, during the third trimester of pregnancy, which has been linked to a notable increase in ASD risk. Parental exposure to common pesticides within a certain proximity of the mother's residence have also been identified as a risk factor. For example, exposure to glyphosate and chlorpyrifos have been associated with increased risk of ASD. Other maternal factors during pregnancy, such as infections and certain immune conditions, as well as the use of specific medications like valproic acid, and complications during pregnancy or delivery, such as extreme prematurity or oxygen deprivation, have also been implicated. It's believed that these environmental factors interact with an individual's genetic susceptibility, potentially disrupting critical early brain development processes such as neurulation, neurogenesis, and synaptogenesis. When we consider the differences between autism and sociopathy, we might observe some superficial similarities in terms of social challenges, but the underlying cause of the way these challenges manifest are fundamentally different. For example, while individuals with autism often possess empathy but may struggle to express it or understand others' perspectives intuitively, those with traits of sociopathy typically exhibit a marked lack of empathy altogether. In terms of social motivation, many individuals with autism have a genuine desire for social connection, but find the mechanics of forming and maintaining relationships challenging. In contrast, individuals with sociopathy may be adept at superficial charm and manipulation but lack genuine interest in meaningful relationships. Morally, people with autism generally have a strong sense of right and wrong, although they might struggle with understanding nuanced social rules, whereas those with sociopathy often disregard moral codes and social norms. And that's another point that would add to me being on the spectrum if you saw my last video. Honesty is another key differentiating factor. Individuals with autism are typically very honest and may struggle with the concept of lying, while sociopathy is often characterized by calculated manipulation and deceit. Finally, in the realms of emotions, people with autism can experience deep and complex emotions but may face difficulties in expressing them outwardly, whereas sociopathy is often associated with shallow emotions and lack of remorse. Lastly, let's delve a bit deeper into the significant role that maternal factors during pregnancy play in fetal development. A mother's lifestyle choices and experiences during the crucial period can have a profound impact on her baby's growth and overall development. Nutrition is paramount, as a balanced maternal diet is essential for proper fetal growth and the development of psychological functions, as well as healthy gestational weight gain. Inadequate nutrition during pregnancy have been linked to adverse outcomes such as reduced head circumference and decreased gray matter volumes in offspring. Moderate intensity exercise early in pregnancy has been associated with lower fat mass in infants, particularly in those who might otherwise have a higher percentile of fat distribution. Conversely, substance use such as maternal smoking is linked to potential developmental issues. Alcohol consumption during pregnancy is generally strongly advised against due to the significant potential for developmental risk, including fetal alcohol spectrum disorder. Maternal weight management is also important, as pre-pregnancy obesity has been associated with increased newborn fat mass, while healthy gestational weight gain is linked to lower median fat-free mass and fat mass in offspring. Perhaps one of the most impactful maternal factors is stress. Maternal stress during pregnancy has been linked to significant alterations in fetal brain development. These can include reduced volumes in key brain regions like the hippocampus and cerebellum, increased folding or gyrification of the cerebral cortex, altered volumes in the amygdala, involved in emotional processing, and disturbances in brain microstructure and functional connectivity. These changes in brain structure and function can subsequently lead to a range of cognitive and behavioral outcomes in the child, such as slower cognitive development, an increased risk of emotional problems, symptoms of ADHD, as well as impaired cognitive development overall. In fact, parental anxiety and depression may contribute a substantial portion of the attributable load of emotional or behavioral outcomes in children. The mechanisms behind these effects are complex and involve increased fetal exposure to the stress hormone cortisol, a potential reduction in the placental enzyme that regulates cortisol metabolism, alterations in serotonin systems, and even epigenetic changes in fetal DNA. The long-term health impact of parental stress exposure can be significant, potentially increasing the risk of psychiatric and cardiovascular illness in later life, as well as leading to an altered brain development that can persist into adulthood, including changes in cortical gray matter volume and gyrification. In conclusion, gaining a comprehensive understanding of these mental health conditions and the various developmental factors that can influence them is absolutely crucial for promoting greater awareness, providing effective support, and facilitating early intervention. The intricate interplay between an individual's genetic predispositions and the environmental influences they encounter underscore the inherent complexity of mental health and neurodevelopmental disorders. Remember, if you or someone you know is grappling with mental health challenges, reaching out for professional help is a sign of strength and a vital step towards well-being. Mental health conditions are treatable, and early intervention can significantly improve long-term outcomes. Thank you for joining me on this continued exploration of mental health. I sincerely hope this information has provided you with a deeper understanding of these complex topics and perhaps inspired you to learn more about mental health awareness and research. Please take good care of your mental health and always remember that it is absolutely okay to ask for help. So yeah, that being said, I hope you enjoyed this video. If you did, make sure to leave a like and comment what you thought of it. And while you're down there, subscribe, not only to help us build the community, but then you don't miss out on my next uploads. But yeah, if you did enjoy this video, make sure to check out the ones before it and my other videos talking about philosophy and different mental conditions. But yeah, I think this video has gone on long enough. I'll leave it here for now. Like I say in all my videos, I love you, stay safe, good luck, and take it easy.